morning. You are welcome to today's lectures. Today, we take a look at principles of farmers technician practice (PPTP) tutorials. So we look at review questions 5. So without wasting time, as usual, we call out the questions, deliberate on the answer options, and pick the most appropriate option. Alright, so the first question for today says, a drugstore is a department of hospital which deals with procurement, storage, compounding, and dispensing of drugs and medical devices. B, a department of hospital which deals with manufacturing, testing, packaging, and distribution of drugs and medical devices. C, a shop where prescription drugs, over-the-counter drug medicines, medical devices, cosmetic, and toilet preparations are stored, sold, and dispensed. Option D, A and B. Option D, A and B. Alright, so let's look at the options again. From the question, basically, before delving into the options, we need to understand what a drugstore is first. So if you don't understand it, you know to answer this question. What is a drugstore? Actually, a drugstore is more like a retail pharmacy, a community drugstore. So what happens there, basically what you see there is prescription drugs actually. You see over-the-counter medicines. You also see medical devices, yes. And you see cosmetics, yes. Toilet preparations are also stored and even sold and dispensed. Now, basically, I want us to understand that this is an OBJ question. So you answer it based on, look at all the options. You are restricted to the options. So for the option now, the most appropriate option that suits to this description is option. For what I've said now, that is option C. That's option C. Because option A talks about hospital. What is that one just about hospital pharmacy? So that is purely hospital affair. It's not community. Option B is also about hospital. So that makes option A and B not to be the answer. Then option D is option A and option B. So option D is out of it. So the correct answer is what? Option C. A shop where prescription drugs, over-the-counter medicines, medical devices, cosmetic and toilet preparations are stored, sold, and dispensed. So the answer to number 1 is C. Alright, so let's look at the number 2. The number 2 question says, the hospital formulary consists of list of dash in the hospital. A, instruments. B, drugs. C, staff. D, patients. Let's look at the option again. What is hospital formula? It's just a list of approved drugs. Of course, it should be in line with the essential medicine list. But basically, that one is formulated based on the one the hospital need. And of course, before such is put into place, over the time, what has been what is endemic in that particular area, and the type of patient they see more around So that we constitute majority of what you see in the hospital formulary. Mainly drugs for such treatment of such ailment. The one that, of course, you cannot say that you have formulated, you have hospital formulary, and almost every day, patient of this category, of maybe patient that have this particular disease or ailment, that one or condition, that one that comes to the hospital on a daily basis, and you don't have medicine for in your formulary for such patient, it cannot work. So in all, in a nutshell, hospital formulary contains mainly drugs. The drug that the hospital is supposed to procure and store for patients' use, so as to meet the patient's need in that locality. So that is what hospital formulary is all about. So it's all about drugs. So the other one is not, they are not part of the hospital formula. They are not part of the hospital formula. Things like tell you instrument, staff, patient is drug. It's not staff, it's not patient, it's not drug. It's not instruments. So the answer is B, drugs. So the most appropriate answer here is B. Number 2 is B. Then number 3. Number 3 says a substantial patient care and financial benefits can be greatly increased by using A, generic drugs, B, branded drugs, C, both, D, no time. The answer is generic drugs. The answer is what? Generic. Why generic drugs? Because generic drugs are therapeutically equivalent and they are also cheaper. In fact, it is recommended that prescription should be on generic drugs so that the hospital will give the one they have. Of course, before the hospital procures a particular drug, at least they so far as a pharmacist working there, a registered pharmacist working there, the hospital is expected to ensure that the source of the drug is genuine from a reputable pharmaceutical company, not counterfeit, not fake, but genuine drugs. So, at the same time, cost effective. So, no matter what you're prescribing as a physician, the hospital, the pharmacist will dispense whatever they have in store because the hospital has the formulary they follow too. So this going by generic will help the patient to be more cost effective for the patient. Not just cheaper, but cost effective. That is the right word. Even though the question says the option say what I explained before, but I talked about cheaper. It's not just about being cheap, but being what? Cost effective. So branded drugs most times are costlier. Most times they are not cost effective. Because I say so because what you can achieve, some of them you can still achieve it with the one that are less, the cost is less. So are they cost effective? They are not cost effective. If drug A and drug B can treat a particular ailment and treat it well, but A is more expensive than B. A is not cost effective, B is cost effective. So the key word is cost effectiveness. And that's what the reason why generic drug is what? Generic is what? Recommended. So option A say generic drugs. So number 3, the answer to number 3 is A, generic drugs. B, branded drugs, no. C, both, no. D, none of them both, no. So the answer is A, generic drugs. Number 4 says, which is appropriate description of average cost? Option A, the value of opportunities which have been lost by utilizing resources in particular service or health technology. B. The total cost, that is, all the costs incurred in the delivery of a service of the healthcare system divided by the units of production. C. Independent of the number of units of production and include heating, lighting, and fixed staffing costs. D. The cost of consumption of medicines is a good example of variable costs. These options are funny. We are talking about number 4, please. These options are funny. Alright. Actually, average cost is the total cost of healthcare system divided by the units of production. Now, these options are very many options. Option A says the value of opportunities lost by utilizing resources in particular service or health technology. No, it's wrong. B says total cost divided by the what? Yes, that is the answer. The answer is B. Then look at C. C says independent of the number of units of production. Opposite. Not C. D says the cost of consumption of medicines is a good example of variable cost. This one just confused. It's there to confuse you. So the answer is B. Number 4 is B. Alright, number 5. Dash is example of a civil hospital. Dash is example of a civil hospital. A. Elect hospital. B. Budget hospital. C. Private hospital. D. Teaching hospital. Teaching hospital. What is the answer? So the correct answer is teaching hospital. So basically, civil hospitals are not military. Please know that they are not military. So teaching hospitals are a common example of what? Of a civil hospital. So all these private, elite, budget hospitals they are not standard. So that categorization is not standard. So the answer is D, teaching hospital. Number 6. Ambulatory patients is dash. Ambulatory patients dash. A. Are required to be admitted in ward for treatments. B. Are required to go home after taking treatment in OPD. C. Require emergency treatment. D. Nota. That is none of the above. Nota. None of the above. Okay. Question number what? Question number 6. Ambulatory patients. Ambulatory patients. So ambulatory patients are required to go home after taking treatment in the OPD. So ambulatory patients are outpatients. Ambulatory patients are outpatients. Ambulatory patients are outpatients. Alright, so whatever you hear in ambulatory, please note that we're talking about outpatients. So that's what ambulatory patient means. Okay? Alright, so now, having said that, let's look at the options again and check whether the answer is in the option. Let me look at the question again. Question 6, right? A. Are required to be admitted in ward for treatment. No, that one is for inpatients. B. Are required to go home after taking treatment in the OPD, outpatient department. Yes, because ambulatory patients are setting with outpatients. So the answer is B. Look at number C. C says require emergency treatment. No, that has nothing to do with ambulatory patients. D says no, none of the above. Yeah, D is incorrect. So the answer is B. Are required to go after taking treatment in the OPD. Question number 7. Which is not true about OTC drugs? Which is not true about OTC drugs? A. are non-prescription drugs. B, are minimally effective and safe as compared to prescription drugs, which are more potent and frequently used. Again, let me go over again. Number 7 says, which is not true about OTC drugs. Which is not true. Excuse me. Please, give me some minutes, please. Let me check something. We are discussing PTP here. Question 5. PTP, question 5, yes. Okay. The first question is A. Okay. The second question is B. Now, one question, just give me a few seconds. The third question is academic drugs. The fourth one is B, the cost of incurred over into production. This next one, which one is teaching hospital? I've not been marking the answers, or just answering them and be good. Then number 6 is B. Number 7. Okay, we are number 7. Okay. Number 7 says, which is not true about OTC drugs. A, are non-prescription drugs. B, are minimally effective and safe as compared to prescription drugs, which are more potent and dangerous. C, are easily available. D, none of the above. What is the answer? None of the above. What is the answer? Number 7, what is the answer? Okay. Actually, over-the-counter drug, that's not OTC, over-the-counter drug. Actually, over-the-counter drug, they are minimally effective, I agree. They are safe as compared to prescription drugs, yes. That's why you can go over-the-counter and pick them, because the effect is they are safe, they don't need prescription. So, then, at the same time, that is basically a important point I want to make there. But when compared to prescription drugs, that is when compared to prescription drugs. So now let's look at the option again and describe what I want to describe. Let's look at the option again. Option A says non-prescription drugs. I agree. Remember the question says which is not true. A is true. So A is true. Excuse me, please let me be sure that this is recorded. Okay, it's recorded. Alright. Are non-prescription drugs. OTC drugs are non-prescription drugs. So A is not the answer because the question says which is not. B says are minimally effective and safe as compared to prescription drugs, which are more potent and dangerous. Wait. Did I say that B is the answer? Or did I wait to? Did I say that? Wait. Let me go to C first. C says are easily available. Are they easily available? Yes. Anybody? Yes. They are easily available. So C see, OTC is available, so C is not the answer. There's a big question mark in this B. That's what somebody I described, which I think is wrong. I'll look into it again before I'll make my conclusion on that. So C is not the answer, A is not the answer, C is not the answer, D says none of the above. D says none of the above. This is confusing. Maybe can you say it again because it says which of these is not true? Okay, none of the above means none of the options are listed is the answer. Is it true? Is it true that none of the options are listed is the answer? Is it true that none of the options are listed is the answer? Is it true that none of the options are listed here is the answer? None of the options are good is the answer. It's true. It's true that none of the options are listed above is the answer. Is it true? It's not true. Because they are not precision drugs, so it's not true. So the answer is D. The answer is D. None of the above. OTC are actually minimally effective and safe as compared to precision drugs, which are more potent. The answer is D. All of the options are correct. Not that is answer because none of the above, all of the above is correct, but because of this say none of the above is correct. So the answer is D. So number 7 is D. Oh, this question is not this. Oh, C question. This can be confusing, man. This is confusing. Wow. C question. Wait, let me go back to this question again. Hey, man. I like this question though. Are OTC really minimally? Are they less effective? Now they are OTC does it render them not minimally effective? That's a video. Are they minimally effective? Does being an OTC make an OTC drug minimally effective? Then this option D, none of the above, which is not true about OTC. Good. None of the above is not true. Okay, which is true about OTC? None of the above is true. None of the above is true. I'm trying to understand this question. I wasn't the one that said this question. So I want to understand the question myself before answering it. Which is not true about OTC? None of the above. A is clear. A is not the answer because A is true. But the person say not true. So A is off. C is true because they are available. C is off. D. None of the above. If for D to be off, that means that none of the above is true. That means that none of the above, for D to be off, that means that none of the above is true. But A is true, B is true. So D cannot be off. The answer is D. The answer is D. Even though this sounds somehow minimally effective, but we are comparing with prescription drugs. Examples. In the treatment of pain, analgesic, using paracetamol to treat pain, and using morphine to treat pain. They are both analgesic. Morphine is prescription. Paracetamol is not a prescription drug. The answer is D. The answer is D. So number 7 is D. One question here. 7 is D. C question. Number 8. Please, if you have a contrary opinion to this number 7, please hit the comment section. Okay? Hit the comment section. Alright? Or you DM me on Facebook. Check out my Facebook channel, my favorite page at Npce TV. Okay? Or Pharmacy Practice TV. Pharmacy Practice TV. Any of them, you see this question there. You can DM me there. Let's discuss it. But from my analysis now, the answer is D. Feel free. Okay? If you think the answer is not D, feel free. Alright, so let's go to number 8. So don't waste my time. Number 8 says DIS stands for A. Drug Information Service. B. Drug Implementation Services. D. Drug Including Syndromes. D. Drug Incorporation Services. What is the answer? Actually, DIS means Drug Information Service. It stands for Drug Information Service. Drug Information Service. Okay? So this service is about getting where you source information. It can be online, it can be online, it can be on site, where you get information about any information you need about drugs. That is where you get such information. So there are different outlets that render these services. So it's called Drug Information Service. Other ones have those combinations to confuse you. DIS actually means, as far as pharmacy is concerned, DIS means Drug Information Services. Alright, let's go to question number 10. Sorry, question number 9. Number 9 says, the objective of hospital pharmacy is A. To teach hospital pharmacists about ethics of hospital pharmacy. B. To ensure the availability of right medication at reasonable cost. C. To attract greater number of qualified pharmacists in the hospital. D. All of the above. Alright, so what is hospital pharmacy? The objective of hospital pharmacy? The whole aim of the different branches of pharmacy is patient care. All the branches of pharmacy, the aim is patient care. But each of them has its own objective. So let's look at objective of what? Hospital pharmacy. In all, hospital pharmacy ensure availability of right medication at reasonable cost. That one is there. We know that. Availability of blood at what? Reasonable cost. That one is there. Of course, hospital pharmacy is the pharmacy in the world, hospital. In fact, in as much as money comes out from them, but in a nutshell, it's not an independent pharmacy that is all that profit oriented. So hospital ensure that's why it's supposed to, you see there's some drugs in community pharmacy like ciprofloxacin. You see ciprofloxacin in separate bags of one blister or one hour pack of 10 tablets in a separate bag. The company produce that one for retail pharmacy or community pharmacy. But you see, company will produce the one that is in small box. They will call it hospital pack. Or they will produce the one in tea, tablet tea. They will call it hospital pack. Because that one is more cost effective. It's the same product, but the cost is lower because they are not packaged individually. They are packed in cups or in boxes. So everything, hospital actually is there to ensure that the availability of medication, even at what reasonable cost. Yes, reasonable cost. So option A says to teach hospital pharmacists about ethics of hospital pharmacy is not true. B, to ensure the availability of right medication at reasonable cost. I agree. The answer is B. Let's look at C. C says to attract greater number of qualified pharmacists in the hospital is not true. D says none of the above is not true. The answer is B. To ensure the availability of right medication at reasonable cost. Okay. So number 9 is what? B. Number 10 says a PRN order is an order for a medication that is used on dash basis in a hospital. A, regular basis. B, every day. C, as needed. D, nightly. So what is PRN? What is PRN? That's the big question. What is PRN? What is PRN basically? PRN talks about what? As needed. PRN is meaning, following it, the abbreviation pro renata. P is for pro, R is for re, N is for nata. So pro renata, which means as needed. So that means of what? PRN. So if PRN means as needed, that means we can let the option now and pick correct answer. The correct option: A, regular; B, every day; C, as needed; D, nightly. So the answer is as needed. The answer is C, as needed. Right. Question number 11. So number 10 is C, as needed. Question number 11. While working in a pharmacy, a technician can locate storage requirements for a particular drug. Excuse me. While working in a pharmacy, a technician can locate storage requirements for a particular drug in which resource? A. Thur's Medical Dictionary. B. Davis Drug Guide. C. United States Pharmacopoeia and National Formulary. D. Manufacturer Invoice. So where can a technician get information information concerning the storage requirement of a particular drug. So this question talks about the reference books, very important. Reference what? Books. Reference books. So such information can actually be gotten from a copy, national formula, from a copy, national formula. So they are reference, the official reference book where you see on the storage. The other ones are just used for administrative purposes or secondary purposes. So the main job book reference book where you get this information is what? From a copy. So the answer, let's look at the options again. Option A says Tabar's medical dictionary. No, this is not the answer. B says Davis drug guide. No. C says United States Pharmacopoeia National. The answer is C. The answer is C. So the answer is C. Let me see. Number 12. 12 says a patient asks a pharmacy technician if it is okay to drink grapefruit juice every day while taking vitamins, while taking a Coumadin. The pharmacy technician should A. Tell the patient that grapefruit is contradicted while taking Coumadin. B. Tell the patient that grapefruit is okay. C. Refer the patient to a pharmacist. D. Tell the patient to call his doctor. Number 12. What's the answer? I like this question. This question talks about the boundaries. The boundaries of a pharmacy technician. The boundaries you should not cross. Yes, your scope of practice. Remember, as a pharmacy technician working under the supervision of the registered pharmacist, you don't take clinical decisions. You take up responsibility that doesn't require the expertise of a pharmacist. If you encounter any challenge that has to do with clinical decisions, refer the patient to the pharmacist. So basically what the pharmacy technician should do is to refer the patient to the pharmacist. So please, as a technician, refer clinical interactions. Very important, because this exceeds your scope. Please, let's note that, okay? Now let me carry options. Option A says, tell the patient that grapefruit is contradicted while taking Coumadin is wrong. Don't take such decision. B says, tell the patient that grapefruit is okay. Wrong. You don't take such decision. C says, refer the patient to the pharmacist. One time, that's the answer. The answer is C. D says, tell the patient to call it off. No, you can't jump to a pharmacist and start telling the patient to go and start visiting the doctor. This is a drug-related issue. So first, the pharmacist should be able to take care of that. Unless that issue has a lot to do with maybe changing the prescription or whatever, then the pharmacist can now discuss with the physician, with the doctor, to take a decision that will benefit the patient better. So the answer is what? Answer to number 12 is what? C. Refer the patient to the pharmacist. Number 13. The process of quickly obtaining an out-of-stock medication in an urgent situation is called dash. The process of quickly obtaining an out-of-stock medication in an urgent situation is called dash. A. Emergency drug procurement. B. Bulk compounding law. C. Code cards. D. Final filter. So what do we do in a situation where there is a big and unprepared, just maybe it just happened. Wow. And there is what is it called? We have out of stock Npce. So what do we now do? In that situation, what do we do? So that is what the question is talking about. Okay, basically, what process is that? What process is taken to be able to achieve that? So what That process is nothing but emergency drug procurement. So the drug will be procured on emergency basis. So emergency drug procurement. So let's look at the options. Option A. Let's look at the options. Option A says emergency drug procurement. That's the answer. B, C, D are no business with procuring with what we are saying. So they are out of the. So they are out of the. If you just continue from where we are, maybe exactly. Just continue from where I just finished number 12 now. So I'm going to number 13. Sorry, I just finished number 13, I'm going to number 12. 13 is A, emergency drug procurement. 13 is A, emergency drug procurement. Okay. So number 14. 14 says voluntary or involuntary removal of a drug product by the manufacturer, usually pertaining to a particular shipment or lot number, is called A. Code cards, B. IVPB, C. Record, D. On call. You say what? What is it? I heard on call. I heard on call. Are you sure?
Yes, recall.
You recall? Okay. Okay. Of course, after manufacturing, that's why you manufacture in batches, so that each batch has a name. If you go to manufacturing outlet now, they will mix the particular ingredients, or maybe they will get in all the ingredients that will be maybe a batch, depending on the capacity of the company and the type of equipment they have that can accommodate large quantity. Maybe in a batch they will be producing like, for example now, 10,000 tablets, for example. Now, they will mix all the ingredients for 10,000 tablets. That is a batch. All the ingredients that they use for that production will be for that particular batch. Now, everything that they are not going to enter into that, they will freeze that batch, or at least mark it, know that the process that is for this batch well marked. So when they are done, it will have its own number, and they will put the number in the packaging as before they will now check
it out.
But if let's assume there's a problem, maybe a problem, and maybe there are one or two things, ingredients is not that wonderful, or there is a problem with data, they can easily retrieve that particular product back. They will just place it, make an announcement, maybe through social media or the official whatever, through whatever means they have. Of course, they have that's why it's good to have a well-coordinated channel of distribution. So that once they hit the wholesaler, for the wholesaler from the distributor to the wholesaler, from the wholesaler to the retailer, even if they find a way, it can be made public. So that then, as given that information, that particular batch number must be in that an announcement. So batch or lot number should be sent back. You see, anyone that sees that product and see the number, he won't take it. He will return it to the retailer he bought it from. And the retailer will gather it, return to the wholesale they bought it from. And the wholesaler will do what? Wholesaler will do what? Gather it and send back to the distributors they got it from. Distributors gather it and send back to the what? The manufacturer. Have you seen how why you don't have a coordinated channel of what? Distribution, not chaotic one. So if there's any problem like that, using the batch number or lot number, the product can be sent back to the company. This process is what is called recall. Product recall. Product what? Recall. Are we together?
Yes.
So the answer is what? Recall. Which is C. So recall is removal of the effective or unsafe drug batch from the market. So the answer is what? C. Other options have no business with that. Okay. IBP means intravenous PG bag. So they have no business with what the question asked us to do. Number 15 says a list of drugs stocked at the hospital which have been selected is based on A. Closed formulary, B. Formulary, C. Open formulary, D. All of the above. What's the answer?
All of the above.
You say what?
All of them.
Why all of the above?
Because in the hospital, there was, let me use this Ojokoro as an example. Here in Ojokoro, especially at Kola Health Center. Kola Health Center.
Okay.
So, if they have lists of drugs they must have on their shelf.
Okay.
And from the headquarters, which is Ojokoro,
Okay.
Ijaye. So, the drug list that they will stock in the shelf is list sent to them from the headquarters.
Okay.
So,
I'm listening. Is that all? Please let go back to the question. So we know what we are saying. The question says a type of formula that requires physician. Sorry, where am I? Okay, 15. A list of drugs stocked at the hospital which have been selected is based on A. Closed formulary, B. Formulary, C. Open formulary, D. All of the above. So what's the answer?
closed formula.
All right, see. It's all of the above anyway. Do you know why? It's formula. A formula can be closed, it can be open. Open has a wider range, there's no restriction. But closed is restricted to a particular approved. Is that correct? So the question they didn't answer the type of, they just say, so whether it's formula which can be what? Open, can be what? Closed. That's why all of them go with the answer. Is that clear?
Yes. All of them.
Yes. Is that clear?
Yes, sir.
Good. Now number
16.
16. Is this 16?
Yes, sir. The main inpatient pharmacy.
Come on. 16 says the main inpatient pharmacy in a hospital that has pharmacy satellite is called A. Community hospital, B. Central pharmacy, C. Community central pharmacy, D. None of the above. What's the answer?
Community hospital.
What are you saying?
Central pharmacy.
Is that what?
Central pharmacy.
It's central pharmacy.
Yes.
That's the main inpatient pharmacy. Because you know what inpatient pharmacy is now?
Yes.
Yeah. The main is the main inpatient pharmacy. Other ones are not correct. So the answer to number 16 is what?
B.
B, central pharmacy. Number 17. A record of medications compounded in the pharmacy is called dash. A compounding log. Sorry, A bulk compounding log. B compounding log. C urethane log. A D all of the above. What does?
Compounding log.
Huh?
Compounding log.
Why do you say compounding log?
Because all compounding must be documented. The name of the patient, the type of compounding the person need. Maybe is a baby need some. Maybe the patient, the baby have any heart-related disease they are supposed to take medication, and the medication is tablets. Baby cannot take tablets, so we need to compound it to syrup so that it can be easy for the relative to use.
So the answer is compound. I agree with you. So compound log records all the compound carried out of the bulk log is just a subset of it. Is that clear?
Yes.
Urethane log is just nonsense. Let me use the word nonsense. It just put it to confuse you. So the answer is what? Compounding what? Log. So number what again? So number 17 is what? Compounding log B. 18. The type of formulary that requires physicians to order only the medications on the formulary list is known as A.
Closed.
A. Closed formulary. B. Open formulary. C. Formulary D. None of them. All of them. What answer?
Closed formulary.
Closed formulary. Yes. Closed formulary. Number 19. A device placed at the end of an IV line that is used to remove particulate matter is known as A. Final filter. B. Depth filter. C. HEPA filter. D. None of the above.
HEPA filter. HEPA filter. C.
HEPA filter. I'll explain. What is that? What do you know about HEPA filter? The answer is final filter. Final filter, HEPA filter. Are we together?
Yes.
Or do you have any contrary opinion? Are you sure?
Yes.
Okay. Let's look at the next question. So final filter is there to is a very important component of IV set. Is that correct? Is there to ensure that to safety and purity of the water that is being administered to the patient. Okay?
Yes, sir.
It's not that point. So the next question is what? 19 is A. Number 20. A small volume parenteral. A small volume parenteral added into or piggybacked onto a large volume parenteral is dash A. IVPP, B. Intravenous IVPPV, B. Intravenous PP bag, C. All of the above, D. None of the above. What the answer?
Intravenous PP bag.
Intravenous PP bag. I agree with you. Intravenous. Have you seen that B was added to the first one that confused you? First option. It's true. Please be careful, okay? But what if the option here is only one B? Option A. What if option A has only one B? IBPB.
We will rather pick that one.
What would the answer?
A.
So you not throw away B.
I don't understand.
What if option A had is just IBPB, not IBPBB? What would be the answer to question number 20?
Is B. Intravenous PP bag.
If option A is IVPB,
PB.
not IVPBB.
The one that is the same thing is A and B.
So what will the answer now?
A and B.
Look at the question 20 and answer close that you are eating. You see you are losing so since you came, you didn't do that. You were here yesterday. You didn't, now you enter class, you are doing that. Yeah? It's wrong now. You be the assist now.
Yeah.
We are the assist. When they come.
I'm not testing. I don't remember.
I say read question 20. You see you are losing focus. Let's go to 20 and tell you what the answer will be. Let's assume option A is just IVPP, not IVPP. So what will the answer to question number 20?
It will be A and B.
If you have to this exam, what will you write? That's the question. Look at the question again.
And the question says a small volume parenteral added into a picky bag onto a large volume parenteral LVP is dash. And we said A is IVPP, not BB. And B is intravenous picky bag. C, all of the above. D, N, O, none of the above.
So what will now answer?
Is B now intravenous picky bag.
Right. I said, what if that option A has only one B? What option do you choose in this question?
Is B.
You will choose B and throw A away. Look at the question now. So stop looking at me and say, based on this question you are giving, look at the question. What will you answer based on the question?
Based on the question?
Yes, now. What will be the answer?
It will be. I said A, you said I will throw A, B away.
If you are writing this as an exam, what will you write?
A and B.
You can write A and B.
IVPB is the same thing as intravenous picky bag.
So if you have to answer this in your casting exam, you go and write A and B there as the answer. In option you are given, what option will you choose? That's the question I'm asking. Which option is that?
C.
Yeah. This is C. These things are small things people miss out in answering that question. It's not just about knowing something, it's about looking at the question well and answering it well. You may enter exam hall now, you go there and say it's A and B, you say hi. Because you didn't connect well to look at all the options, you say the option is not there. Some we even go to the extent of using their pen to write A and B on the side. Whereas the option is looking at them, simply choose the option that says all of them. That's what I'm trying to correct. You made that mistake, but you didn't know that you didn't know that you made a mistake. And you see, people made that mistake. Their eyes did not see all of their above in option. Some think that the option is not there, they leave it back and go their way. Some will even go and start using their pen to be writing A and B, whereas there is option C there, and they will fill it. So I noticed what you were saying. That was why I insisted, so you can correct yourself, because your mind wasn't in the option. If your mind was in the option, you could have just said the option is C. Simple. That's what I'm trying to correct. Not to prevent you from keeping quiet. Then move to the next question. But I want to correct it so that you don't make that mistake in the examination hall. People made a mistake on them. I've seen people that made that mistake. The option is they're looking at them. But because their mind is only on the one that has the answer, it's only on what they're seeing. They say, the option is some people go and start writing for you by the side. So the answer is not in the option. Whereas all of the above is there. Please, you are begging. So, but due to the fact that they added B, which doesn't make sense, that renders A invalid. That's why all of the book is not the answer. The answer is what? B. Intravenous PG back. So 21 says a form that tracks the medications administered to a patient is called dash. A. Formulary. B. Medication administration record. C. Patient wristband. D. None of the above.
Medication administration record.
Medication what?
Administration record.
Are you sure? How? How does that?
Patient is inpatient.
You said medication administration band.
No, I said the form that track the medication administered to the patient. It means the patient is inpatient. Patient on admission.
Okay.
So medication administration record.
Okay, good. That's I thought I had medication administration plan. Okay, it's medication administration record. MAR. I don't know whether it was in this case that I mentioned UDDS, unit dose dispensing. Unit dose dispensing. Dose, count of the dose given at a particular time. So all these things are recorded in what? MAR. Is that correct?
Yes.
So 21 is what? Option 1. 21 is what? B. Good. 22. Protein, carbohydrates, and essential nutrients given to the patient through an IV line are known as dash. Protein, carbohydrates, and essential nutrients given to the patient through an IV line are known as dash. A. PRN order. B. Total parenteral nutrition (TPN). C. None of the above. A. All of D. All of the above.
Total parenteral nutrition.
Yes, I agree with you. I explained that in this class, right? I don't know if you were in the class. Total parenteral what? Nutrition. Number 23. A hospital pharmacy that services patients who have left the hospital or who are visiting doctors in a hospital outpatient clinic is known as A. Outpatient pharmacy. B. Pharmacy satellite. C. Center pharmacy. D. All of the above.
Outpatient pharmacy.
Good. Outpatient pharmacy. A. Outpatient pharmacy. 24. Which of the following rules can be performed by a pharmacy technician? A. Counseling a patient on repeat prescription. B. Transferring a drug on prescription drug list. C. Helping a patient choose an appropriate non-prescription medication. D. Calling a physician to recommend a medication that is covered by a drug plan.
D.
What is the answer?
D.
D is what?
Calling a physician to recommend a medication that is covered by a drug plan.
You have no business with a physician. So far you are transplant technician working on anything clinical you need to do or to call it maybe anything, any report you want to make or anything you report to your what? Pharmacist. Is that correct? So option B is not the answer. You have no business with leaving your pharmacist and going to a physician unless the pharmacist asks you to do it. Of course, if pharmacist says please do this, he sees pharmacist that is sending you, he sees pharmacist that maybe he's doing something. Maybe he's only pharmacist there. You want to help him, just meet the doctor. You are not one, you are representing the word pharmacist. But he's the one that gives you the authority to do what? If pharmacist will not be there, you jump and start saying doctor is wrong. Is that correct? You don't do that. So the option D is not the answer. There are many other options. Option A says counseling patient. You have no business with counseling patient, whether it's repeated or not repeated. You have no business with counseling patient. This says transferring a drug on the prescription drug list. You have no business with all those ones. Helping a patient choose appropriate non-prescription medication. Non-prescription medication. Now, what do we mean by choose appropriate non-prescription medication?
Like NSAID. Like NSAID medication. In case of maybe the patient is an ulcer patient. So
that's why if you go to like now, that's why as a pharmacy technician now, you can run a pattern medicine shop where you have mainly OTCs, mainly. Is that clear? In that place, you don't need a pharmacist to come and work with you. The two of us, if patient can come in, that what the patient needs is OTC. You can say, okay, maybe you come and say, I want to buy paracetamol. You say, okay, you can look at it. If I want to buy so drug OTC, you can recommend that one that is still better, depending on what the patient complains. And that's why you are doing AUM. So that you're not totally naive on pharmacology. So you can handle those small things without even correcting a pharmacist. If not, they will have insisted that if a pharmacist should come and register a place for you, they can. That's why they can utilize it. They cannot put such place based on their training. Their pharmacy council of Nigeria is certain that for you to pass all your courses and do their council exam, and you need to know some of these things. Is that correct? So the answer is what? C. Number 25. The main responsibilities of a pharmacy technician may include all the following, except A. Preparing medications orders. B. Conduction of units inspections. C. Administering medications to patients. D. Monitoring patient drug therapy. What else?
C. Administering medication to patients.
Say what?
Administering medication to patients.
Are you sure?
Yes. Pharmacy.
What if it's a pharmacy technician that did nursing before coming to pharmacy technician?
If
What is it for pharmacy technician that did nursing? Nursing.
Okay.
Before coming to.
But not in the pharmacy premises.
Not as a pharmacy.
Yes.
Not as
a pharmacy.
So far in pharmacy, you're not working as a pharmacy.
Yes.
If you want, go and open a nursing home and working with doctors. But so far in pharmacy, it's not a business. So the answer is what?
C.
Is that clear?
Yes. Okay, we now call option 1 to 12.
Sorry.
Answers to question 1 to 12.
Okay. 1 is A. 2 B. 3 A. 4 B.
5
D.
6
B.
7
A.
8
A. Sorry, 7 D, sorry.
7 D.
Sorry.
9.
8 is A, right?
Yes.
9 is B.
10.
10 is C.
11.
11 is C.
C.
Yes.
12.
12 is C. Alright, so do you have any questions so far? Because we have come to the end of Pptp review questions 5. Any question? Alright, so in absence of any question, we'll stop here. So I'll give you time to finish marking that. I'll collect it there. I'll now give out that for AUM question 6. AUM review 6. Alright, thank you very much. God bless you.